I have another question for Dr. Heimann. Dr. Heimann, why wouldn't we use precautionary principles when regulating water fluoridation as opposed to risk management? There are so many conflicting issues here. Why would we not take the precautionary? We have done that with, we're even doing it today with car seats. Car seats now have expiry dates on them because there may be something that comes along that's better. We're dealing with science that goes back to the 50s and 60s. Why are we not taking the precautionary road and doing this research that needs to be done and then making the decision as opposed to using old science?
Okay. Well, but research continues to be done, and I would be pleased to, and really it's my responsibility to provide the information specifically to the questions which have been asked and the issues with regards to safety. And certainly, if that is not able to be done, then it is absolutely appropriate with regards to the precautionary principle. But from the information that I have looked at, is that we are looking at a public health measure, which in fact is and continues to be safe. But again, that's my requirement, to be able to provide you with the studies, with the information which you asked for.
I guess my question is, have safety studies been done to confirm the safety of this product as it relates to Standard 60? There seemed to be a gap there as I heard it, and I'm just looking for clarification, so I'm not sure who can answer the question.
Through you, Mr. Chair, it has been raised that NSF, or the National Sanitation Foundation, allegedly has not carried out tox studies. While there have been tox reviews, specifically tox studies, and they, we're speaking to HFS in particular. It would appear that they have not carried out those.
And it's a matter of choice. As we have rights and freedoms, and as a matter of choice, and knowing that there are several things questionable about this product and how it's placed in our water and how it affects it, and there are again several unknowns. Why would we not have that choice? If we've not had that choice since the 60s to make that decision. It's been on again, off again, but we've never been given that choice.
The matter of choice is something that none of us can answer, because that is in fact a council issue with regards to choice. Absolutely, it's my responsibility to provide you with the information to make an informed choice, but it is not, I have no authority to dictate whether or not communities should or should not be fluoridated.
byproduct from the fertilizer production classifies as a hazardous waste, and again, that's going in our bodies. There are no safety studies on the product, and also it deals with, I like proof in terms of the artificial water fluoridation. It's not protective of formula-fed infants. So there's a lot of these issues that if you want fluoride in terms of tooth decay or whatever, you can use toothpaste, but when you have to drink that water with the fluoride, you don't have that choice. And so to err on the side of caution, it doesn't hurt ceasing fluoridation. And again, you leave it up to WUC, the Windsor Utilities Commission. They're the ones that are supplying us with water, and they're recommending to the City of Windsor. So I support that we cease, and that recommendation goes to them.
At this point, in making this decision now as a council, it's to acknowledge that the scientific data is incomplete. If we ever entertain having fluoride back, it has to be pharmaceutical grade.